Calcium supplements. This is one of the most popular health supplements out there, especially for women. Many healthcare providers are brainwashed to encourage calcium supplementation to their patients. It's in the textbooks, it's taught in classes, it's promoted during internship clinical training. But how many doctors, scientists, and researchers actually analyzed the risk to benefit ratio of using oral calcium supplementation? What you say? There are actually risks? Isn't calcium great for your bones? Shouldn't I drink a lot of milk? Why would taking calcium pills be harmful for you? Well, let me lay it all out to you this way. Have you heard of kidney stones? Have you heard of calcific tendonitis? Have you heard of heart attacks? Have you heard of constipation? Well, guess what? Calcium supplementation has a role in making each of these possible. What? Calcium can increase your cardiovascular risk? Yes. As a doctor, one of the tests I can order to evaluate someone's cardiovascular risk is by ordering a coronary calcium scan. It's also called a calcium score test or a cardiac CT. So guess what we are looking for in this test? You guessed it, it's calcium. Plaque that is clogging your arteries and decreasing blood flow calcifies over time, and the more calcium we detect in the test, the more seriously clogged your arteries are. The higher the score in the test, the more likely you will have a heart attack in the near future. Do you see a connection now? Calcium in your bones, awesome. But calcium in your arteries, not so good at all. I want you to look up the differences of dietary calcium versus oral calcium supplementation. Numerous studies have shown that intentional oral supplementation with calcium causes calcium to go to areas in the body we don't want them to be. While if we get the calcium from our diet, the less often this happens. Why? Because the way nutrients interact with each other changes how they are absorbed and used. This is an often ignored but absolutely critical concept to understand. The properties of one item changes when it is in combination with other items. For example, when I prescribe a Chinese herbal formula, all I have to do is change one ingredient in, say, a list of 10 herbs in the formula. The action of the formula completely changes. Even though each ingredient has its own properties, in unison, they either complement or neutralize each other to different degrees. When we consume nutrients through food, it is more balanced naturally and also gets absorbed by our bodies more naturally. This is in total contrast to supplements we purchase online or in stores. They are all manufactured and will in no way be able to replicate how nature balances them with other nutrients. The closest way I can think of in getting calcium naturally is to take vitamin D3. Vitamin D is really only obtained through sun exposure to your bare skin. Most foods do not naturally have vitamin D. Oily fish like salmon, mackerel, and sardines have some vitamin D. Eggs, red meat, and liver have some vitamin D. Some types of mushrooms have vitamin D. None of them, however, provide enough sustained amounts. Vitamin D helps the body absorb calcium in our foods naturally. Therefore, using vitamin D circumvents the problems we just discussed with calcium supplementation. For women, this is especially important during the teenage years and young adulthood, where the vast majority of the calcium content is deposited into the bones. At about 30 years of age, bone mass stops accumulating. As a woman ages, there is a net loss of calcium slowly from the bones, no matter how hard you try to force the calcium into the bones. This is in part due to the gradual decline of estrogen in all women as menopause approaches. You can only slow down the net loss of calcium from the bones. Efforts to reverse this, even by medications, is temporary, and once the medication is stopped, the calcium loss starts to accelerate again. The only thing you can do is to make sure you maximize your natural absorption of calcium from your foods during your entire lifetime. There are no shortcuts.